DECA to me is like one of the worst things. It's a safe drug as far as like side effects to the body, but the way you feel on it, like most people that's ever taken it will tell you instantly, like, I hate the way I feel on it.
I hate the way I feel
yeah,
on it.
Absolutely, yeah. And I think because of that, and here we come back to this, so back in the day, that's what they would use. They would take a little bit of testosterone, a little bit of DECA. If you talk to the old guys, that's what they'll tell you, right? They'll tell you, like even back in Arnold's day, that's what we took, right? Now, like they don't go to that. Like they're like, listen, I feel like shit on that, but I can take tren and feel crazy. I'll stick with the tren. But it's a much harsher
on your
thing.
body.
And we're being pretty open here. So
yeah, no, that's
like,
what I'm asking.
We're like laying it out there.
How about
that's
equipoise?
It. Equipoise is actually very similar to like DECA. It's almost, they're different drugs, but the makeup, the way they respond in the body, almost identical. I like that one though because it doesn't have a lot of the, like, you know, side effects and type of thing, like decreased, you know, that.
How would steroids decrease?
You'd be surprised. So it just literally lowers your. There's so many effects that it has like on it, but the equipoise doesn't. So people will have a tendency to stay away from DECA and go to EQ. But it's also a slower acting drug. So DECA is really slower acting. And most people don't use DECA because it can be detected for so long. So that's why they stay away from it.
Here we go. So this is the next topic, HGH and insulin.
And insulin.
Yep.
So this is where the sport changed, obviously, from like a certain point.
96,
90s
94.
and stuff, yes.
Okay.
And so the growth hormone had always been around. And I think people were using it, but what they didn't realize is how the effect of the two work together simultaneously. And basically the insulin, and the insulin kind of had, like when it first came out, I think that people overdid it. You know, honestly, I do. And I think, like, you know, me and even a couple other, you know, people were kind of the first ones that was like, listen, if you take the insulin every single day, it stops working. Like literally. And, you know, there was people I was like, listen, you know, how long have you taken that? And they'd be like, oh, I've been doing it now for 3 months. And I'm like, how much are you taking? They're like, 15 units a day. I'm like, I'll tell you what, take the 15 units and don't eat. Don't eat any carbs. I'm like, holy shit, I'll crash. And I'm like, I'm telling you, you won't crash. And they would call me back and they'd be like, holy shit, like I took the 15 units and I didn't crash. I'm like, exactly, because your body now is used to it. Like your body is literally limiting what the natural production is. And so I think a lot of people, the nutritionists like that knew what they were doing, literally kind of curtailed that a little bit. But up until this point, it has been very, very limited. It was used very like once or twice a week. It was used maybe a couple times after training, you know, a week or something like that, just to make sure that everything was completely loaded, completely, you know, like the body was functioning at 100%, but they weren't like abusing it, trying to force glycogen nonstop. But now there has been a little bit of an, like the protocols that are out there that seem to be floating around are bad right now. They're like really bad.
What's the biggest difference between the side effects of HGH and insulin versus steroids, anabolics?
The totally two separate, you know, things. I mean, obviously steroids are all really based off of testosterone and those types of things, where growth hormone is basically you're based off your growth hormone levels. And insulin is obviously, you know, based off of insulin levels. So they all have a different functioning purpose within the body. Now, obviously, all three together are a very powerful combination. And realistically, maybe one of the most powerful ones is insulin. As when you're looking at, you know, the hormone mega, it could be the most powerful hormone within the body, but it doesn't do legitimately what you think it's going to do. And I think a lot of people, when they first was introduced to it, they thought like, holy shit, I'm going to do all of these things and I'm going to look like Nasser El Somebody, or I'm going to look like
and
Jay
that's not what's
Cutler.
going to happen.
No, it's not going to happen. Like they can take insulin all day long. Most of the people that I see that take high doses of insulin just get fat.
Just get fat.
They just get fat, yeah.
You hear about these. Your thoughts on this?
So I hate this stuff. Like all of the synthol and this stuff, there are some people, I think most people hate it. Like I can tell you it's the one thing that I hate within the sport. I can honestly say, like, I've never, ever, like, you know, like encouraged an athlete of mine to take it. I've had 2 athletes of mine use it, and it was literally kind of against my, that I don't like it. I think that it is one of those things that we literally have no idea what it is. And everybody's like, it's, you put it in the muscle, it stays in the muscle. There's no chance it can stay in the muscle. I don't care how much of it you pump into the muscle. There's no chance. It has to end up somewhere, and those places have to be brain, lung, heart. If it doesn't clear out of the system, it's going to end up there. It's going to end up almost like cholesterol. Like, so if you've seen an artery that is filled with cholesterol, my thinking is, how is this not binding to it? How is this not binding to cholesterol? And a lot of people think I'm nuts. I know Dave Palumbo is a big, very, he's very proactive on this, but he sells it also too. It's not illegal in any way, shape, or form. But I'm just one of these guys that thinks that it is not a positive for our sport.
Could this kill you?
I think 100% it can kill you.
Is there stories of that happening or no? In the world of bodybuilding,
they're not necessarily. I mean, there's a lot of stories where people have had trouble with it. I know of a guy that literally had open heart surgery from Chicago that took it, and when they opened him up, they literally had that shit everywhere. Like, it was everywhere. So they're,
Why is it so popular? Why are people like, is it to get it without doing the work? I mean, even some of your guys that did it, they're well-known bodybuilders that use some of this stuff.
Sure, there's a lot of, I mean, that's the thing. I mean, I think a lot of people have done it. I think a lot of well-known people have done it. There has been some guys that have done it that you either couldn't tell, or at least it looked really well. They did it really, really well. I think those are far and few between. I think that there's very few guys that can do it.
The reason why you are here after the response we got with Sean, and we're getting a little bit deeper in this topic. So now, let's go to the last part of what he said in the video, where he says, this person's life, that person's this person.
Right.
So obviously these are some names here. We'll go through them together. You obviously know who these are.
Right.
Munzer, El Sombati, Matarazzo, and then we have some other guys here we'll get to here in a minute. Okay. So, when you look at this, what was the cause of death was somebody? Because Sean put that on you.
Put that one on me. Right. So here's the thing with Nasser. So